All right. Welcome in. Tap the screen. Share the live. Today we're going to be discussing healing the digestive system, so detox tools and how to use them specifically for objective findings. Hey, Daphne, good to see you. So last week we covered subjective. We went over detox questionnaires. We went over, how we use questionnaires. We looked at the nutritional assessment, the detox assessment, and then we also, we also looked at, how to bring all this information together. And so this week we're going to go over even more information, going over objective testing. And then on Saturday, we're going to really work on how to put all of this information together, because it's a lot of information to put together, right? So subjective, remember, is what our patient tells us. And then objective is something outside of me, something outside of you that we can measure to really see, we can get to root cause analysis, but also to determine if a protocol is actually working or not. So let's go ahead and move in. My apologies. It's been so ridiculously hot here in St. Lucia and raining and allergies and it's been a thing. So definitely thank you for your patience with me. Okay. Our learning objectives for this evening, we're going to be interpreting our bowel transit time, because we're looking at several different objective findings. So we're going to be evaluating your bowel transit time. We're going to focus on urinary pH, but we're also going to bring in salivary pH. Thanks, Ramesh, for liking the live. We're also going to look at stomach acid results to evaluate and interpret that. And then we're going to start to look at those patternings. Hey, Shay, welcome in. We're going to look at those patternings that indicate dysfunction, specifically in digestion and assimilation patterns, and elimination, because we discussed a lot about our food and the role of our food. Thank you for the heart, me. And so we'll put this all together and really begin to understand. So today I'm really going to focus on mainly on the actual testing part, the objective analysis aspect. Hey, friend. And then we'll go from there. So hold on one second for me. Hello. Yes, Daphne. Much better view, I would say, on YouTube for sure. Okay, so this is our outline for our class today, our class agenda. Let me pull it up. All right, so we're going to just do a little bit of a guided breath just to get ourselves here. We're going to reflect back on our week 3, just a little bit, a couple minutes, nothing crazy. Then we're going to talk about digestive system function overview. And then we're really going to go into that deep dive on testing. We'll see if we have time for some live case practice, and then we'll really identify underfunctioning in the digestive organs and how we address them. And then I'll leave you guys with your assignment. All right, so trying to balance both here. All right, so our teaching tools, we're going to obviously do our objective testing, which I'll go over. And so you'll want to be tracking those. We'll be looking at your digestive functioning map, which is a visual correlation, just looking at your organs and your symptoms for accurate assessment. We also discuss kind of that daily digestive tracking, really looking like that Bristol chart and, the urinary color chart, etc. Same thing with that visual pH reference guide and then your symptom companion. Our course goals here are really to equip you with understanding non-invasive functional tests for assessing your digestive health and understanding what it means when they're high, when they're low, and really what to do about them, how to interpret them, and really be more proactive instead of reactive. And it's really about connecting all of the dots. So, it's a lot of information for sure, but take it a little bit at a time. And of course, we'll go deeper on Saturday. So our assessment tools that we're utilizing, we'll discuss an optional stomach acid, baking soda challenge, bowel transit time, urinary pH, salivary pH, and then if we have time, we'll talk about some different diagnostic tools. And recognizing hypoacidity patterns, meaning you don't have enough stomach acid, timing and evaluating your bowel transit time, your acid alkalinity balance, and then correlating your findings based off of the information that you pull in. For this class, required assignments are the detox questionnaire, your urinary pH log, your bowel transit time. You can also submit that bonus stomach acid test result if you so choose. This may not match up with our discussion prompt in our in your community. However, I wanted to make sure that you're kind of thinking what's surprising you the most about these digestive test results, because hey, catechismus, because it's really about you being really present to what the results and findings are, and then naturally what you do about them. So let's start in on the functions of the digestive system, kind of beginning from the top down. I always say we're healing the digestive system from the top down. So we focus on the mouth, where we have mechanical breakdown, the chewing, the churning. Also, when it gets into the digestive system, we have peristalsis, which transforms that food into more absorbable particles. Then there's chemical processing. We have lots of enzymes and acids that break down all these complex molecules, such as your proteins, into more usable nutrients, such as your amino acids. We'll look at the role of the small intestines in nutrient absorption, really transporting those vitamins, minerals, and macronutrients into your bloodstream. We'll talk a little bit about barrier function. We'll go deeper in on Saturday about barrier function and making sure that you have proper intestinal barrier function. Hey, Dr. Michelle. And then naturally, we'll discuss elimination, waste, and toxicity. All right. So jumping right in to our pH levels of our digestive system. So first things first, we want our mouth to be slightly acidic, but still neutral to the environment. And the reason for that is we need salivary amylase to break down our carbohydrate our carbohydrate nutrients. So what we need to do is get our pH levels to 6.5 to 7.5. On the high side, I like it around 7.2, quite personally. So we want more alkalinity in the mouth. And then our stomach needs to be highly acidic, that 1.5 to 3.5. Naturally, you're not going to be able to test, your stomach acidity unless you using a Heidelberg capsule test. A Heidelberg capsule test is it's like a machine. You swallow a capsule and it actually tests all your pH levels from the top down. Obviously, that machine, not a lot of people have it. It's not as accessible, definitely not brought into the conventional medical model. And so this is kind of the way that we do this, is kind of the next best thing. But the reason for that high acidity is to break down proteins. Low levels actually activate pepsin and kills pathogens. So definitely want to make sure that we're keeping our immune system stable and keeping it healthy. Moving into the small intestines, it's going to be more alkaline as the bile neutralizes that stomach acid. Remember, the bile is created in the liver and then it's stored in the gallbladder. And bile is definitely a lot of challenge with people, especially if they're eating a high fat diet or not a balanced diet, or they don't have enough stomach acid. So then the maldigestion happens. And so this more alkaline state enables enzymatic digestion and nutrient absorption. Then we look at our large intestines, which is going to be more on the neutral side, definitely slightly acidic, from bacterial fermentation, and then your microbe is going to maintain optimal pH balance. So still kind of in that I call it more neutral when it gets there. So, imbalanced pH levels can indicate digestive dysfunction. And so, monitoring this can be incredibly helpful, especially if you struggle with any digestive related challenge, which we'll talk a lot about this evening. Hold on one second. Let me get back to where I'm going. All right, cool. So salivary pH levels. So this is going to be what you're going to test in your mouth. So morning, as you first wake up, you're going to test your salivary pH. As fasted, we want it between 6.4 and 6.8. And then midday before your meal, 6.8 to 7.2. And then post meal, we want to slightly increase, no higher than that 7.4. Remember, your salivary pH indicates enzymatic activity, oral microbial balance, so meaning if there's any sort of bacteria or things like that that are growing in the mouth. And then also, too, it's an indication of nervous system regulation. Low pH levels indicate that sympathetic dominance, so that fight or flight response. Poor oral microbiome, so meaning that the bacteria in the mouth is not balanced, and then naturally inadequate enzymatic secretion, so not enough of your enzymes to actually break down. Really, proteins is the focus there, but carbohydrates also classified. If your pH is high, then compensatory response to acidity, over mineralization, and indications of bacterial imbalances. Common symptoms that you may not be aware of would be dry mouth, bad breath, coated tongue, and naturally poor digestion, gassing, bloating, that sort of thing. So we start in, again, healing the digestive system from the top down. So we're going to test the salivary. We did that mostly in our Intro to Holistic Medicine 1, as we were looking at nutrient deficiencies and making sure, that your mouth pH levels were in balance, because it's an indication of what you're putting in, specifically the alkalinity behind your diet. So, again, healing the digestive system from the top down. Now we're going to focus on our stomach acid. So this is an optional test for this class. It's not required, but it is an indication of your stomach acid, how much stomach acid that you may have. So what you're going to do is you're going to mix about a 1/4 teaspoon of baking soda in about 4 ounces of water. I recommend warm water. It just kind of makes it for a little bit more of a pleasant experience. You're going to drink it first thing in the morning, before you eat, before you drink anything else, and you're going to monitor how long it takes to burp after drinking. Normal is you would burp 2 to 3 minutes after you drinking the baking soda. If your stomach acid is low, it's going to take longer than 5 minutes, so 5 minutes or more. So remember that low stomach acid impairs your protein digestion, increases infection risk, and of course reduces your nutrient absorption, because again, you're not breaking down the food. So some symptoms of low stomach acid that you may not be aware of. So you bloating after protein-rich meals. Remember, looking at what our protein sources are: chicken breast, turkey breast, whitefish, but even legumes, nuts, things like that. Gassing, belching hours after eating. So you're belching, again, this is a chemical reaction. Premature fullness. So you may feel full longer, especially if the gallbladder is compromised. And then prolonged satiety, meaning that you're going to feel like you're full longer, not get necessarily those hunger pains. Acid reflux and GERD are also typical symptoms. And then naturally, you're going to see undigested food in your stool. This does create nutrient deficiencies, so you will have post-meal fatigue, brittle nails, thinning hair. Iron deficiency anemia is also an indication here. Low B12 levels and poor wound healing. So there's going to be challenges on the immune system. Within the small intestines, there's a microbial imbalance. So what do I mean by that? Infections, because again, you have these large protein molecules not fully digesting, processing through the liver and going into the small intestines undigested. So a lot of times chronic yeast happens as a response. Hey, Kayla. SIBO or H. pylori infections also can be indications. Persistent bad breath because you have these infections, multiple food sensitivities. But remember, it's not just about the food that you're eating, it's the food-like substances, herbicides, pesticides, etc. And then histamine intolerances because you have allergic responses. So again, like I said, it's hey CD Lovely. We're in like rainy season, hurricane season. So if it gets loud, we have a tin roof. So if it gets loud, I may have to figure out something else to make sure you can hear me. So low stomach acid clinically is called hypochlorhydria, which disrupts both your digestion process and that detoxification pathway because of course you're in essence generating more infections and not absorbing properly. So if you don't have the energy that the body needs in order to function or metabolize your nutrients, your detoxification pathways are going to be inhibited. So this is why we do at home, we would call them in-office tests. We used to send patients home with this test, but this is a very simple test that you can do at home to assess for low stomach acid. So let's say you do your initial salivary pH in the morning and it comes back, let's say a 5 or low 6s. Here's some different things that you can do in order to improve those numbers. So first things first, take 1 tablespoon of raw apple cider vinegar. That's with the mother, so it has a little bit of cloudiness in it, in water before your meals. Also 2 fresh lemon juice is also alkalizing. So 1 to 2 teaspoons works, and you're going to consume that 10 to 15 minutes before your meal to allow for greater alkalization for a better digestion. When you get into herbs and things like that, you can use gentian, dandelion root, or Swedish bitter, to stimulate acid production. I actually like Quicksilver Diagnostics digestive bitters. Those work really, really well. But also too, using teas like ginger tea, fennel tea, that sort of thing. So starting your meals, hey, John Brown, starting your meals with bitter greens like arugula or radicchio, I think is what it's called. So lots of your bitter greens, your kales, your collards, things like that. And remember, half your plate needs to be coming from these bitter greens. So it should, the alkalinity of these bitter greens should help with greater digestion. Now, if parasympathetic activation is your challenge, meaning you're in more of a fight or flight state, you want to be more mindful, practice deep breathing before your meals, and of course, avoid eating when you're stressed. So if you're stressed out, not going to be a good time to eat because again, that sympathetic, parasympathetic response system, you cannot rest and digest in that sympathetic response. So you're going to be more in that fight or flight aspect, which is going to inhibit digestion just simply based the cortisol production alone. Natural salt, unrefined sea salt also provides chloride, which is essential for hydrochloric acid production. So you're going to choose your mineral-rich natural salt varieties like Celtic or Himalayan sea salt. They have about 86 cations and cations in them, and so that can really help for remineralization. So again, this is low stomach acid protocols without medications. Very simple at home. There are a little bit of herbs involved, but these herbs are fairly benign. Naturally, you want to check with your doctor, but also make sure that the patient is not on any blood thinners because that could, be contraindicated. Again, we talked about ways to naturally increase the low blood sugar, but we're going to kind of continue on. All right, there we go. So supplement wisely. So I kind of went over that first rung of things to do. Really easy, mostly food-based. But if those numbers are still not going up, a lot of times I'll put just a patient on a green powder supplement that they take a couple times a day. So that's going to be like your chlorella, your spirulina, those sorts of greenery. Most people have those kinds of green powders laying around, but let's say that that isn't increasing the number. It should increase the number fairly quickly as long as the patient is changing their diet and eating healthier. You may have to reduce the patient from an animal-based protein diet, perhaps to more of a plant-based protein diet, focusing more on alkalinity versus acidity. Not to say that now all of a sudden that's going to be the end all be all, because you still have to heal the damage that has been done to the digestive system. But let's say after all of that, still you're not seeing progress. That's where betaine hydrochloric acid with pepsin come in. But again, that should be used really, really under a professional advice. If you do use betaine hydrochloric acid, thank you for the populars. You're going to start with 1 capsule mid-meal and increase until you feel that warmth. That warmth is that indication that your body's had enough. Naturally, if you have ulcers or you take NSAIDs or any steroids, you want to avoid using betaine hydrochloric acid because it is contraindicated. Yes, exactly. Also, if you are on any sort of PPI or antacids, that can impair digestion, especially when overused. When you look at the disclaimer for PPIs or antacids, you can only use them for about a year. Unfortunately, many conventional doctors will plug and play those types of medications, meaning that they'll put the patient on it and won't follow up on the patient, won't monitor the patient. And that's kind of like a continual thing. And so then the patients get stuck on these PPIs, which is contraindicated for any long-term period of time. I think I think it's a year is the cutoff for that. You also want to space out your meals, so allowing your stomach to rest. Naturally, we'll talk a little bit about even doing some mild, like half-day fasting, just to give your digestive system a rest. You want to avoid constant snacking, large meals, especially in the evenings. Eating and then laying right down, of course, is going to affect your digestion. If stress is really where most of the challenges are, chronic cortisol, the hormone that your adrenal glands produce in response to stress, is going to disrupt your HCl production and digestive function. So if you have high stress, you want to incorporate some sort of breathing technique, some sort of heart rate monitoring, some sort of relaxation technique, either meditation, breath work, etc., box breathing. It can be any sort of different things to be able to bring the heart rate and that cortisol down. Also, make sure that the patient's sleep is balanced as well, because if a patient is not going to sleep, staying asleep, and waking up refreshed, then naturally they're not going to be really stress resilient. So keep that in mind. So now we're going to transition to our bowel transit time. So that was all about our salivary pHs and symptoms and why and all of this. Now let's look at our bowel transit time. So this particular test, you can use several different methods. You can use beets, you can use corn, you can use sesame seeds. You can also use activated charcoal. So I put beets and activated charcoal kind of as those two mainstays. You're going to consume 1 to 2 whole beets. Write it down when you actually eat it, and then track how long it takes for it to first show up in your stool, and then how long it takes for it to completely clear out of your stool. If you do an activated charcoal supplement, you can do powdered, or you can just consume 4 to 5 capsules, usually does it, of activated charcoal until, again, you're going to first see the gray, and then the gray disappears. Ideal transit time is 18 to 24 hours. I would say more on the 18 than the 24-hour side, but 24 at least lets us know you're in that window. That indicates healthy digestion, motility, and of course, elimination. Slowed bowel transit time suggests there could be a sluggish liver, dehydration, poor vagal turn. Poor vagal tone, meaning your vagal nerve, again, related to stress. Fast transit time, which is under 12 hours or really under 18 hours, indicates inflammatory response. There could be infections as well, such as SIBO or H. pylori. All right, hold on one second. Oh, hold on, let me Let me go back. Okay. So bowel transit time actually measures the time that it takes from the food to enter your mouth all the way to elimination. So it's tracking that. It also reflects your gut motility, digestion efficiency, and your microbial balance. So your bacteria within your GI tract. Optimal transit supports effective detoxification and nutrient absorption because remember, we have nutrients we build into the body, and those nutrients then help support our energy, but also help support our detoxification process. Less than that 24 hours, again, I really go with 18. Toxin, the body is going to recirculate toxins. There's metabolic waste reabsorption, encouraged dysbiosis, which is an imbalance in the intestinal flora, and then is an indication, like I mentioned, about a sluggish liver function. This is also why I tend to clean the liver out first before going into the digestive system, because a lot of times if you go just to the digestive system and you skip the liver, you're kind of having to do double duty, because if the liver is sluggish, it's dumping into the small and large intestines, and if efficiently, it just doesn't make sense. If your bowel transit time is less than 12 hours, but again, my opinion is less than 18, but I tried to be a little more on the conservative side, there's nutrient malabsorption issues, so the patient is not absorbing properly. There is potential for electrolyte imbalances, potential for dehydration risk, and also potential for food sensitivities. And so we'll address that. And so if the patient's bowel transit time is very slow, probably not indicated for them to detoxify, at least detoxify more aggressively. So again, the purpose of taking these objective findings is to really see how is the body doing in its current natural state, and then what we need to do to support in order to build the body up to detox and then eventually rebuild the system. So remember that build, detox, rebuild is kind of our process. So it takes about a month to get the diet in order to build. We focus on, let's say, if you're going to detox the liver, you're going to focus on getting those detoxification foods in there. And then you're going to build testing, seeing what's going on, repairing any of these issues that are perhaps not working efficiently. I kind of think in terms of repairing the metabolism and preparing the body for detoxification, and then finally we go into a detoxification process. So it's not a fast process. It's not a quick. There's a lot of get healthy quick out there, and the body, I just want to really stress to people, the body doesn't work that way. It takes a lot of time. We want to be kind to our bodies. We want to be loving to our bodies, all the things. Symptoms that you may have if you have an abnormal transit time, so that's slow transit time, 24 to 36. You may have infrequent or hard stools with straining, persistent bloating, foul smelling gas, systemic issues such as brain fog, acne, headaches, detoxification impairment like a coated tongue or body odor. If you're under those 12 hours, that fast transit time, loose urgent stools with undigested food, abdominal cramping, incomplete evacuation, so meaning you're not completely eliminating, nutrient deficiencies, which could lead to, again, we talked about the brittle nails, hair loss, etc., and also chronic fatigue, because you're not getting, your car is not getting the gas that it needs. So of course you're going to be driving around pretty sluggish. Electrolyte imbalances exist as well because you're losing minerals, and energy crashes throughout the day. So your transit time really reflects any underlying digestive dysfunction. Identifying your pattern helps you to target your interventions. First intervention is always going to be food. We have to clean the diet up. It makes no sense to detox a person when their diet is trash. And it may take a while. Like, even though I'm like, okay, it's a month, it may take more time, to convince a patient, educate a patient, motivate a patient to be able to change their diet. There may be, we talked about this in Holistic Medicine 1, there may be time constraints, there may be financial constraints, there may be stress restraints, there may be a lot of restraints that are in the way for patients eating a healthy diet. So once we determine what's going on with the bowel transit time, how we begin to repair and heal. With slow transit time, we're going to increase our fiber. We're going to work on combining soluble and insoluble fiber. Think your chia seeds, your flax seeds, your root vegetables. You're going to hydrate deeply, that minimum of half your body weight in ounces, and add a little bit of that pink Himalayan sea salt to the water to mineralize the water. Naturally, spring water is going to be your better friend, along with filtered water. You're going to stimulate bile flow, so that's with those digestive bitters, lemon water, ginger before meals to help stimulate that bile flow. Any movement, so walking, yoga, helps support peristalsis, especially after eating. I love to, me and my husband will go for lunch, and then we'll go for a nice long walk afterwards, and really just to help our bodies in the digestive process. Also, too, magnesium citrate. Also, we are very depleted in magnesium because our soils are depleted in magnesium. So supplementing with magnesium, 500 milligrams to start with, and then you can go up from there. You're going to track your progress using your Bristol stool chart that you were given in the first week. I'll make sure you have it in this week too. And you want to aim for those formed and soft stools, that type 3 to type 4 from your Bristol chart. If you have a very fast transit time under 12 hours, you're going to identify any sort of triggers. So food intolerances, infections, stress patterns that may be present. We're going to strengthen the lining of the GI tract. So think glutamine, aloe vera, slippery elm are all helpful to repair the gut lining. Glutamine is an amino, aloe vera is a plant, and slippery elm is also a plant. So aloe vera and slippery elm are herbs. And then you can choose binding agents, but you have to do them very strategically. Short term, I kind of like more of the pectin-rich foods, such as your apples and things like that. Those can help before I go into maybe like an activated charcoal as a binder. Just because if the bowels are moving too quickly and you start to bind them up, that can create some challenges within the digestive system and just the elimination overall. Your calming protocols, so nervine herbs such as chamomile, such as kava, such as valerian, those can all, thank you, John, those can all really help with your nerves and your anxiety, and just in general, your fight or flight responses. And you want to eat much smaller, spaced out meals to really allow for proper digestion. So why does transit matter when we're detoxifying? So your colon really serves as that last filter before waste exits. So we want optimal transit between toxins from re-entering your bloodstream. We don't want it too long. We don't want it too short. And healthy digestive rhythm supports all your detoxification pathways. So remember, those are your primary eliminatory organs, your liver, your large intestines, etc. And so we want to make sure that those primaries are working properly, because otherwise it'll lend itself to your secondary, your skin, your reproductive organs, and your sinuses. Your downstream effects, so proper elimination, is going to help support the liver, help support the skin, help support the lymphatic flow, and you want to balance your transit to help improve any mood stability, hormone stability, or energy levels. So if you have any sort of energy crashes, hormonal instabilities, or mood instabilities, remember, majority of the immune system, neurological system, and hormonal system is all housed in the gut because of the gut microbiology changes, and all of those bacteria are created in the gut. So if you have issues with the hormones, it's very tempting, if your hormones are out of balance or your nervous system's off balance, it's very tempting to go try to manage those symptoms. And I'm not suggesting you don't manage those symptoms, because of course, you want to be comfortable. However, if you don't address the metabolic issues, meaning you don't address how you're processing nutrients and how you're eliminating toxins, you will never balance the hormones or the nervous system or the immune system in general. You're going to just constantly be chasing your tail. But we are in very much a reactive healthcare system. And so people focus on the symptoms while neglecting their health and their own responsibility. That's why we frame it. Health is not an absence of symptom or disease, but a state that we create that is based off of the World Health Organization. Like them, love them, hate them, whatever your feeling is, but they're the ones that determine, a lot of our different health guidance. So when the colon functions optimally, every other healing effort becomes more effective, simply because all diseases, I don't care what it is built off of instabilities within the metabolism. So working on your metabolism and making sure you can exchange nutrients to toxins properly is really, really, really important. Okay, so now we're going to look at your heart rate. Remember we talked about this. So it's kind of a lot of food allergy, food reactive, food sensitivity testing is highly inaccurate. We talked about the RAS test, which is more of the pinprick test. Very inaccurate. We've talked about IgG, IgM, IgA. And while those tests can indicate more sensitivities or intolerances and can potentially show you reactivity, it's not the be all end all. And so sometimes, testing, while, it may be helpful to kind of guide you in the right direction, not always accurate. And for my opinion, I don't like when patients spend a ton of money on testing, and especially testing that could be inaccurate. And so what we want to look at is heart rate tracking. We've talked about this before, especially in Intro to Holistic Medicine 1. So if you suspect a food your body's having a reaction to, because sometimes it's like, every time I eat gluten, I have gassing and bloating, right? Every time I eat dairy, I have mucus. Every time I eat soy, I get congestion. And so sometimes we want an objective analysis to be able to say, is this really something that's going on, or is it something else? Because we're trying to isolate out the variables. So you're going to take your pulse rate. You can take your pulse rate on your wrist. You can take it on your neck. You can also take it on your ankle as well. A lot of the watches and things like that, your Fitbit, Apple Watch, they will also take your pulse rate for you as well. So you're going to take your pulse rate for a minute as you're relaxing, record that number down, and then you're going to put that food either under your tongue or in your mouth. And you're going to then don't chew it or swallow it. You're going to then wait about 60 to 90 seconds and then check your pulse rate again. If there is an increase of a minimum of 6 to about 10, it's going to indicate a sensitivity, meaning that fight or flight response system is going to be activated, your stress response system. Some of the common food triggers are gluten, which encompasses wheat, barley, rye, your dairy products, your refined sugars, your eggs, your soy, your corn. These are just some of the ones. We also have nightshades as well. So that's going to be like your eggplant, tomatoes. Those are also really indications. So this is going to show us that stress response. So it's going to give us an immediate response in terms of how your vagal nerve is accepting or receiving that particular information. So if your pH levels are too high, that alkalinity, that can, meaning like your salivary is, let's say 7.5 and beyond, it could be indication that there is an immune system reaction with food. So then you would use this objective analysis. So urinary pH levels, we're going to move on to urinary. If you guys have any questions, feel free to drop them in the chat. Let me make sure with the YouTube. Okay, everybody's good on YouTube. All right, so urinary pH. So we wake up, we do our urinary pH assessment. And this is how well the body is eliminating acids, managing your minerals, and also processing metabolic waste. Remember, your kidneys help support your liver. So it's actually your detox pathway 3, which we'll talk about as we get into more detox pathways for the liver. And so it offers a window really into how efficiently your body is detoxifying. If it's very acidic, meaning 5.5 and below, suggest either high protein intake or you're not breaking down your proteins. Stress responses, inflammation can lead to mineral loss and, of course, urinary irritation. If it's optimal, that's 6.4 to 7.0. I think 7.2 is kind of the sweet spot there, but or at least the highest end of that. But really anywhere that 6.8 is perfect. And that reflects a balanced acid-base function, meaning good hydration, you're efficiently detoxifying, and there's a lot of metabolic resilience. If the is acidic at that 5.5 to 6.2, that can be from chronic processed foods, coffee, low vegetable intake as well. We do need vegetables. We need most of our diet needs to come from our complex carbohydrates, our fruits and our vegetables, more in those alkaline fruits and vegetables. So if you have a low vegetable intake, it can affect your detoxification ability. And so it can indicate an incomplete detoxification process. So normal urine is going to kind of shift and change regularly. That's why we track it over a 2-week period and we're tracking patterns. So 6.0 to 7.5 based on your diet, your hydration, and your timing. So you want to track patterns rather than just a single reading. Same thing like with your blood pressure, really any sort of objective finding that you're going to take from your body. You're not just going to get one marker and run with that. You're going to test it really over a 2-week period of time and get your averages. If your urinary level is 7.1 and above, can indicate really a lot of vegetable rich diet and mineral supplementation, but can also, if it's above a 7.5, it can indicate that there's kidney distress and or infections. So if the liver is overly toxic, when I think we talked about this before, I've used examples, but if the liver is overly toxic and the liver is compromised, it's going to lean into the kidneys and then the bladder. And so a lot of times with kind of think about drain off, if there's a lot of heavy metals in the liver, it'll drain off into the kidneys in that phase 3. And then a lot of times it'll create a lot of bacterial infections, especially chronic ones. You have chronic urinary tract infections that because you don't want to keep using antibiotics over and over and over again because you create antibiotic resistance. It really affects microbial balance within your GI tract. A lot of people get yeast infections, et cetera, because it throws off the microbiology in the digestive tract. So if there is a chronic infections, urinary tract, et cetera, you want to really focus on the liver, not necessarily the kidneys. The kidneys is more of a symptom. And so just keep that in mind. So symptoms linked to urinary levels. Let me see. Let me get. Let me see if I have the right. Okay, there we go. If you're too acidic, meaning that low pH, less than that 6.2, fatigue, persistent brain fog, which is going to impair your cognitive function. That can be because of the protein maldigestion and the accumulation of yeast within your GI tract. Frequent urination, burning sensation can indicate an irritation as well. Joint pain, muscle cramps, because you're not processing your minerals, so your mineral depletion, so your magnesium, your chloride, etc. Sugar cravings can also appear. Thank you, I Am Culture, for the likes. Sugar cravings can appear. Obviously, your blood sugar can drop. And hey, Tic Tac Tim, can drop and fluctuate. And so if you go into a hypoglycemic state, meaning a low blood sugar state, that's where anxiety, that's where irritability comes in. And detoxification really becomes compromised. And again, your body's going to lean to those secondary drainage pathways, your skin being one of them. If you're too alkaline, meaning that the pH levels is 7.2 and above, cloudy, foul-smelling urine, like ammonia is a lot of times what it will smell like. Doesn't always smell like that, but a lot of times a strong ammonia smell can indicate bacterial imbalance, but also not clearing those histamines. Digestive distress, so gassing, bloating, constipation, and poor absorption. Like we talked about, those recurrent UTIs really suggest a compromised urinary tract environment. Again, think about that as like a reservoir of drain off. Electrolyte imbalances. So again, you're not absorbing properly. So there's a lot of indication for electrolyte imbalances, which of course are going to disrupt your cellular communication because your cells need all of those key minerals and electrolytes for energy. Increased risk for calcium crystallization, which can lead to kidney stones within the kidneys. Very, very painful. So we want to make sure that our pH levels stay consistent. I would say to check this probably twice a year. You're going to do it for a 2-week period of time and then get your averages. pH imbalances often manifest long before clinical conditions develop, which is why I'm teaching you guys this, because this is subclinical information before it creates a disease process that then has to be diagnosed and managed. We want to be proactive instead of reactive with our health. And so early detection through simple at-home testing can really prevent serious complications, but also keep you more in the driver's seat to your health. So now we'll look at treatment. Let's see. Nope. Treatment strategies. If the urinary is too acidic, you're going to consume more dark leafy greens. Cucumbers, lemon, those have a lot of hydration plus alkalinity. You can supplement with a mineral supplement, potassium, magnesium, calcium citrate. Drink half your body weight in ounces of water daily, full stop. Practice stress reduction techniques such as deep breathing, relaxation. Hey, Jelly. Support liver with digestive bitters, and of course, lymphatic drainage like your dry brushing. If the body is too alkaline, meaning the urinary pH is above a 7.5, you want to screen for any sort of urinary tract infections because you'll want to address those. You want to add apple cider vinegar before your meals. Also, you can add lemon water. You want to reduce any alkaline mineral supplementation that you may be taking. So if you're doing a greens powder, you want to maybe back that off because you're driving yourself into too much of an alkaline state. You also want to improve your protein digestion with enzymes. So that would be where you would perhaps do your stomach acid test to be able to see if you have enough stomach acid to properly break down those proteins, because that could be the issue right there. And then renal herbs, so herbs for your kidneys like parsley and nettle can be really helpful. So those are some of the treatments, strategies to normalize your urinary pH. So let's put this into perspective. In the morning, typically your urine is going to be more acidic, 5.5 to 6.5, due to overnight fasting and you're building and you're accumulating and metabolic processes. Then right after your meal, it's going to shift to more of an alkaline state, or it should, as digestive processes are going to release the minerals into circulation. Now, if you don't have enough minerals to release into circulation, your post-meal is not going to be as high. In the evening, it should return back to a mild acidity, reflecting your daily detoxification patterns. And then naturally during active detox, it can show some increased acidity because you're cleansing and in a healing phase. So like we talked about, you're going to track your trends over a 2 to 3 week period instead of a one and done. And you're going to integrate the findings with your salivary pH, your symptom patterns, your bowel transit. Yes. So it doesn't really matter when your first meal is, Daphne. So Daphne on TikTok asked, even if your first meal isn't until noon. Yes, it doesn't matter the timing of the meal. It's just your post meal. So you should maintain, first thing in the morning is going to be more acidic. Perhaps before your meal, I tend to recommend, if people are fasting or intermittent fasting, that they drink a lot of water. They hydrate with minerals prior to, so they'll have the water with some apple cider vinegar and lemon. You can go overboard with apple cider vinegar, so be easy with that. But you're going to be checking your pH level, so it should be pretty good. So it doesn't really matter, particularly the timing of that meal. This is kind of what it looks like when you're tracking it, just as a little example. So we've got 4 readings there, and we're kind of looking at it in the chart: our morning, our midday, our evening, and our night. So we kind of see the patterning, the urinary bodies, the buffering system capacity, and the systemic acid overload. Ideal range is 6.4 to 7.0 for first morning void. And then your common symptom imbalances, again, we talked about it: joint pain, fatigue, muscle tightness, headaches, etc. All right. So why are we doing all this? Detoxification and elimination. We want to prevent any toxin recirculation. So before we start to release things out of the body that we don't know are there, and let me tell you something, you don't know what you don't know about the human body. Every single body is different. Every person's exposures are different. Every patient's nutrient levels are different. So you really have to be low and slow. These really harsh detoxes. Hey, Ocean, these really harsh detoxes, like we talked about, the food, water, vegetable juice fast, all that kind of stuff. If you are not testing the body objectively to determine these things, you do risk you recirculating your toxins. So that will just null and void the whole point. If you're trying to detoxify, you don't want to recirculate your toxins. So you want to make sure that the digestive system is actually able to eliminate properly and recirculate, and that your bile and stool process is working well. Also, too, we want to make sure that we support any nutrient deficiencies that are in the body, because that can slow our phase 1 and our phase 2 liver detoxification pathways. Next week, we kind of really start in on phase 1, phase 2, phase 3 liver detoxification, and I'll break all that down for you so you can understand what's happening with the liver. Also, too, you want to minimize any inflammatory process on any of your primary or secondary eliminatory organs, like your kidneys, your skin, your lymphatic system. And we definitely want to, if you have any sort of mental, emotional, psychosocial, spiritual aspect of it, we want to stabilize the body. Otherwise, irritability, anxiety is going to worsen. That gut-brain connection is also going to suffer. So remember, the digestive system houses majority of the immune system, hormonal system, and neurological system. And so we want to detox at both that cellular, hey, Robin, good to see you, and systemic levels. Okay, so we'll go over briefly data collection. We're going to go deeper into this with more kind of practical case studies on Saturday, but just so you can kind of get this idea. So our subjective is our patient's experience. We're going to use our detox symptom questionnaire, which is going to track the symptom intensity and frequency. We also will look at your nutrient assessment questionnaire from Intro to Holistic Medicine 1, but also look at energy levels with the patient. You do not want to detox the patient if they have low energy levels. If you detox a patient with low energy levels, you are going to just make their energy levels worse because your body needs enough energy, meaning enough nutrients for your daily activities, but then it's going to need a little bit more. So we have to build the body up first in order to detoxify. And when we detox, it takes out the bad and the good at the same time, which is why we rebuild after we detox. Your mood and your emotional state, you do want to track, because naturally, with detoxification and letting go, there's mood and emotional things that come up. And so helping guide your patient through those experiences, and looking at sleep patterns, which reflect nervous system overloading and your adrenal resilience. Remember, your adrenal glands are your stress glands. Other things that we can track too, like cravings and appetite, which point to blood sugar instabilities, sweat or body odor, which again is activating that secondary drainage pathway. Skin changes, again, activating the secondary drainage pathway. I really pay attention to texture of my skin, dryness, patches of dryness. I take a lot of time actually just assessing my skin when I get out of the shower, just to make sure everything feels, balanced and healthy and supple. And then a symptom journal, which is going to capture daily shifts that may be missed. So remember, this is all coming from your subjective data, what the patient feels. We're going to combine your subjective with the objective. And our objective patternings, we're going to look at our pH testing, so salivary and urinary, but this class primarily focuses on urinary because it's a detoxification element. And then our bowel transit time, where you can use beets, sesame seeds, corn, activated charcoal, and also use that Bristol stool chart as well. With your urinary pH, there is the urinary. Yeah, I actually have a symptom journal. I think I put it in last week, but if not, I will put it in this week. I wanted to make sure. I think it's in there, but I'll double check because I think I created one and then I didn't really like it, so I don't think I finished it. So we'll look at that. Thanks for the question. And then we can look at your functional responses to, let's say, like stomach acid testing to identify hyperchlorhydria, which is low stomach acid. You can also use the heart rate monitoring to detect hidden food sensitivity. So these are quantifiable tools that are going to objectively measure the success of what it is that you're doing with your patient, or you're your patient right now, so your self. So you want to track these for a couple weeks to really get a good idea of where you fall, your patient falls, etc. Definitely do this on yourself first before you go practicing on people. The nature of this class is really to learn for your own and then eventually branch out from there. So subjective and objective. So subjective, again, client reported symptoms like fatigue, bloating, brain fog, but also captures the emotional context and the nuances that your lab work isn't going to indicate. Your objective markers like your stomach acid test, your urinary pH, salivary pH, transit time, it's going to help to show you trends and prevent clinical guesswork. So we don't guess, we test. And then clinical insight, now you can start to connect the dots, looking at things like poor protein breakdown, toxic recirculation, fatigue, inflammation patterns. And this is going to drive more of a personalized, effective detox strategy. Now, again, this is basic. We're starting at the ground floor. We can get way advanced. And hopefully, if you're enjoying learning and getting this really deep, very, very nuanced type of holistic medical approach, then you'll learn much more detoxification strategies. I really can't wait teaching you guys some more things that I've learned, especially about patterns with patients. So it's really a lot of collection of patterns that we see when we start to line this data up. We're looking at subjective, we're looking at objective. We can really start to make some assessments, and you start to see the patternings again and again and again, which then what really becomes rewarding is that even when you're speaking to patients, they're already saying things you're like, yep, clip, yep. And so majority of the work tends to come from the subjective side, tends to come from your motivational interviewing. And then you're using your objective analysis to prove or disprove your hypothesis before then you create a treatment plan. So here's an example, just so you have it. So when your acidic urinary pH is like a 5.5, the patient's going to report brain fog. Stomach acid testing shows a hypochlorhydria, which is that low stomach acid. And so then you understand what's going on. So you're going to have to shift the diet, do some dietary education, work on building up the digestive bitters, maybe some apple cider vinegar, maybe some lemon, maybe some greens powders as you check that salivary pH levels. Then you look at that bowel transit time and actually see how the food is moving through. You can repair any minerals, maybe have the patient do some box breathing or something to help with their stress response so that they're digesting better. Like one thing that I say all the time is I digest how I feel. A lot of times if patients don't digest how they feel, they kind of hold for impact. They're not going to actually digest their food. It's going to be in that suspended state because the cortisol is going to be inhibiting acetylcholine, which is going to affect digestion. And so, you start to build a story for a patient. You start to understand what's actually happening to their body. So again, just a recap. All right, cool. So subjective, again, captures that client reported experiences and felt sensations to validate. Symptom journals, which document day-to-day challenges. Intake questionnaires can reveal patterns over time. So I typically will do that nutritional assessment questionnaire once, but then I'll do follow-ups. I used to do them literally every appointment at one point when I was really heavy in practice, so we could see fluctuations over time and see symptom reductions. Also, it was helpful as a CYA because patients are in it. So maybe one day they feel great, the next day they feel horrible and they think nothing has happened. And so I would every 3 weeks do that nutritional assessment questionnaire and look at the patternings. That way, when the patient's like, oh, this isn't working, this isn't doing well, etc., I pull up the data. I go, well, this number used to be this number used to be that. Now this number is down. Now this number is here. And it really was able to, again, that objective finding to be like, hey, you're actually improving here. Check-in conversations unveil emotional components. I used to see patients pretty regularly every 3 weeks. Now I see them every 2 months on average. I do have some patients that I still see every 3 weeks, but those check-ins are really important to have those conversations in terms of how the protocols are doing. Hey, Laura, the objective tools, remember in this class, we're going to do pH testing, that to measure that acid alkaline balance, transit time to address digestive efficiency, and heart rate monitoring also looks at your food reactions. And we're almost done. Thanks for hanging in there a little bit over. So pitfalls, you may be influenced by your bias or your perception. So again, you have to remove yourself from the situation. Hey, Gwenselly. You can miss emotional context and nuance for your patient if you are not being objective. There are subjective tools that we use for emotional health. When we get into emotional classes and stuff like that, I go over subjective tools for that. But the clinical value is you really want to educate your patient about the why behind why you're doing this, what you're going to gain out of it, what symptoms may be associated with it, and then you're going to validate the patient with the data. A lot of times when I do a full review with a patient, review of their labs, review of their records, a lot of times they say, yeah, nothing you said is surprising, but it really feels good for somebody to tell me that I'm not crazy or that this makes sense. Or, it's very rare that it's like way out of the park. The next kind of thing that usually patients will do is, how bad is it, right? So because we've been conditioned and programmed in the conventional medical system, when you see a doctor, it automatically means that something's wrong, something's bad, something you have to fix, et cetera, which is also one of the reasons why people avoid seeing the doctor, because the messaging is either there's nothing wrong with you or everything's horrible. There's not a nuanced subclinical communication, and it doesn't put the patient in the driver's seat. And so I like to put the patient in the driver's seat. I like to give them proper informed consent, but I also like to give them the tools from a public health education perspective so that they can be more in control of their health. I always like to say, look, you're only going to see me, an hour, maybe 30 minutes out of an entire month. And people could not pay me enough to walk around with you and say, okay, drink water, sit up straight, don't put that in your mouth. People would pay for sure for me to walk around with them and monitor them, but you really want to begin to learn how to hold yourself accountable because, eventually I'm going to retire everything out and not be working so hard. Effective practitioners integrate both approaches. So this is a mixed method approach in study. In my PhD, so I started 2 separate PhDs. I haven't really kind of honed in on my thesis, so I paused them. But I started one and switched over to another because I felt like it was more setting. So PhDs tend to, be your life's work. So I wanted to make sure that it's really good. But even in my PhD, I always was looking at mixed method approaches, which were subjective and objective. Subjective or qualitative is all the questionnaires and nuance around the human condition. You see them a lot in psychosocial questionnaires, so sociological ones. But then we need that objective analysis, something outside of me, something outside of you, to counterbalance all of that, just so we see, how the body's actually functioning. So really combining both, that's more of a quantitative where it's just data driven. So it doesn't, quantitative alone without qual, it takes the humanity out of it. When you put them together, it adds the texture of the humanity, but it adds that objective finding that then you can see, is this replicatable? So effective practitioners are going to use both approaches to create comprehensive, personalized protocols that address root causes rather than these isolated symptoms. All right, let's see. I think we got to the end here. Perfect. So week 4, just to summarize, I'm going to wrap up now. Here's what we worked on this week. Stomach acid pH testing. So we talked about the baking soda challenge, urinary salivary pH, urinary dehydration color guide, which you got in the first couple weeks. Digestive assessment tools, your bowel transit time, your Bristol stool chart, as well as your symptom journal template. So your detox symptom questionnaire, your bowel transit time, your urinary pH log. I'm only requiring 3 to 5 days, but technically you should do it for 2 weeks. And then optionally, you can do that stomach acid test. I highly recommend it just to make sure everything is flowing the way that it's flowing. So these are the things that are to be worked on and due. It is week 4, so technically they're due this week. However, if you still need more time, it's fine. Next week, we start to move into the next 4-week block, which is all about your primary, secondary, eliminatory organs. So we go deeper into how these organs are actually functioning, so you can begin to understand while you're collecting your data what may be happening with your body. You want to be like a detective. You're really like a healthcare detective, kind of assessing, what could it be? What could it be? So you're not making any conclusions till the end of the class. That's why, we kind of take a break from the data. And then, as you're accumulating your data, we get into how the organ systems are functioning. That way it'll start triggering, that, and then we pull it all together in the last 4 weeks and we create our case and our detox plan of attack. So, all right. So we did it. We got through our Wednesday's class of objective data for detoxification. I am your host, Dr. Erica Steele, your professor. I am a holistic doctor, and how I came to be like that is I'm a board certified naturopathic doctor. I hold 7 degrees in my field, all in the natural healthcare space. I like to say that I went to school so you don't have to, combining science with spirit. I do believe there is a so vast amount of information in this world. This class is Intro to Holistic Medicine 2. We are in week 4 of this class. It is a class that you can register at for any time. Just click the link in the bio, scroll down and click it. Intro to Holistic Medicine 2 is all about detoxification and elimination. Intro to Holistic Medicine 1 is all about nutrient deficiencies. And we touch a little bit on accumulated toxins, but really this class is specific for detoxification. So at the end of this 12-week class, you will understand more about how the body detoxifies and have a very simple way to learn how to detoxify the body in a very healthy way, in a very balanced way, without all of the gimmicks, without all of the, fast acting, really harsh things on the body. People, I find, use way too many herbs and pills and potions and all this stuff because they really don't understand how the body works. They haven't done the education in the sciences. And so I love science. I love how the scientific process and how the body works. Because if you understand how the body works, that's why I love biochemistry so much. When you begin to understand how the body begins to function and how the body works, then what you do is you're not trying to fix the body. You're not trying to force the body. What you're trying to do is simply support the body at these different biochemical chains to allow for the body to do what it already knows how to do and what it's already created to be able to do. So we're not trying to fix or force or any of those things. We're actually accessing the body's own ability to detoxify itself. We're just kind of biohacking it in a sense, but not in a weird, bro podcaster sort of way. So awesome. Does anybody have any questions before I sign off? Thank you so much, Miss Luxury. I appreciate you for the heart me. I took a break this morning from morning flow. Again, sinuses, allergies, heat. It has been raining nonstop here. And with all of the rain comes all of the mold and all of the plant life that is well bound all over this island. So this week has kind of been a little like, ugh, and it's just been so hot and so muggy and so humid and so yeah, we've been really worn out here on the island, but our plants and foliage get lots of love during this time. So I'm excited, but definitely bring on the dry season. I'm more of a dry season girl. I'm like dreaming about Palm Springs right now, dreaming about being in the desert and just drying out because like all my sinuses, everything are just crazy, which leads me to kind of my last point is if you do struggle with allergies, that is a sign that your detox pathways are sluggish. So this is a good time. I did a couple of days of detoxing and then kind of took a break. I'll probably regenerate and take a couple more days, etc. So if you have a lot of allergies, that is also a sign too that your body needs a little bit of a break. So, all right, cool. If there's no other questions, I'm going to log off. This class will be available on YouTube for the replay, but of course, I'll put it in your course shell this evening, along with the summary and all the information. And I'll finalize that symptom questionnaire. Also, too, Kayla, you should have gotten your new certificate. Let me know. I sent it last week, so hopefully you got it. Hopefully it works well for you. If not, please, shoot me an email. And I'm happy to change it up. So, all right, guys, thank you guys so much. I will see you. Oh, I'm so glad. Yay. I know that like makes my heart just like open, like, yay, Kayla got her certificate. So that's super exciting. I really love teaching everyone what I've learned. Yes, well, finish your work, girl. Finish your work, Daphne. Reach out to me if you need some help and support. Yay, I love it. Yeah, this has been just, 20 plus years in the making, probably even longer, to be able to educate you guys. I have learned so much. Oh, I'm so excited. I've learned so much over the course of practice and the time, and I've been through so much in this field, still continue to go through quite a bit, just trying to advocate for natural medicine, holistic medicine, and Afro-Indigenous practices. We truly are the innovators of this work. And I think combining what we did pre-colonization, we did all of these things. We did the herbs, we did water, we did light, we did all of these things. And so now we're in a post-colonized healthcare system. And we have science and we have scientific tools. Unfortunately, as we learned, most studies are backed by pharmaceutical companies. About 85% of studies that are put out are backed by pharmaceutical companies. So there is a lot of biasing around that, even peer reviewed. So I really, when I closed my practice in 2023 and I took a year off studying the business side, I got my MBA at that time, and I studied the business side of healthcare, really looking at our pain points as Black people in the healthcare community. And public health education is a huge pain point. So getting information out to people, educating people, making sure that they know what they can do proactively with their health that does not involve a doctor, I think is really important. So if you know anybody that struggles with any of the symptoms that we talk about, please share this information with them, just so that they can get some relief and they're not going through the same cycle of, not being heard, not being validated, being gaslit, etc. I'm still working on this article for Psychology Today. I feel like it's going to be the unalivement of me. So on creating safe medical spaces. So wish me luck as I continue. I'm like down a deep rabbit hole. Hopefully I finish it sometime soon. So, all right, guys, I'm going to log off now. I will attempt to be on live tomorrow morning, 6 a.m. morning flow. I should be pretty good, but we'll see how all my sinuses and all of the rain and the all of the elements and I work together as a team. So if you have any questions, feel free to reach out to me. Happy to assist you, happy to help. My DMs are open. Thank you so much, Miss Luxury, for attending. Thank you, Oceans, and congratulations to everyone who participated, and like, share, comment, and subscribe for more.